Good afternoon. Good morning to everyone. I thank the organizers of PCSI 2021 for giving me the opportunity to give the oral presentation of my abstract. I have a two-portion part of this talk. One is transcatheter closure of ASD with the TE guidance, having problem and how we circumvented that problem, and followed by my study on this, whether can do away device closure of ASD with of a T-guided procedure. Okay, so I move on to my talk. So it's my abstract is transesophageal echocardiographic probe is a hindrance for LA disc deployment in ASD device closure. Over 3 decades, transcatheter closure of ASD is established and a safe procedure, and it is being performed routinely under a T and fluoroscopy guidance. Last decades, we saw many centers started to do transcatheter closure of ASD under TT and fluoroscopy guidance. Some centers they do only TE guidance, and some centers do only TT guidance, especially from China. They do many interventions without any fluoroscopy. Advantages of T-guided procedure is clear images because the T probe is very close to the left atrium. Disadvantage of the T usage is potential injury to the throat and esophagus, causing throat pain, mucosal bleeding, aspiration, and incurring additional T cost. So I am going to give a few video clips where under T guided procedure, where he had a problem, then how we circumvented that problem. The first case, you can see that's a 22 years old female, large osteochondrum ASD, and then we are able to close with that one. Second case is a 18 years old female with a large ASD. Then we close this defect with T guidance. Third case is a 21 years old male with a large ASD. Then we close this defect with the 24 mm device. Fourth case is a 34 years old female with a large ASD, close with the 28 mm device. So all these 4 examples, did you see anything? So you probably you may observe. I'll just explain again another fourth one. See that, look at that. See the T probe, look at the, try to pull it down, it's not coming down. So that you can see the T probe just, it's not, it's preventing the LA disc coming and align with the atrial septum. Once I remove the T probe pop, it's coming and aligning nicely. So this was the problem actually. It happened once accidentally, then we try to do it this way. Whenever it gets stuck in the middle of the LA, then we just pulled up, it's got aligned with itself. So failure of LA disc aligned with the atrial septum when T probe was behind the LA. LA disc aligned immediately once T probe was pulled up. So this cause of this problem probably due to compression of LA by the TE probe. So this successful deployment technique encourages us to apply in our subsequent patients whom we face the similar difficulties. Probably roughly about 50% of patients have the similar problem. Then based on that, thought of do a study on that prospective study, whether you can do away with the TE, how much, what is the problem. Okay, so we selected all the groups, age groups, there's no age biased. So out of 173 patients diagnosed to ASD, only 13 patients were included in the study. 60 patients were excluded from the study because 36 patients had poor image quality by TT. So we electively did under deep guided procedure. 24 of them had insufficient rims, so they were sent for surgical closure. So symptomatic patients, the age size of more than 8 mm and the right heart dilatations were included in our study. The age group of our study population ranges from 7 months to 75 years, median age of 6 years, and the weight of the study population ranges from 5.5 kg to 84 kg, median weight of 16.5 kg. The size of the defects range from 8 mm to 36 mm. Median size was 20 mm, and 2 patients had 2 defects. Out of 113 patients, 109 patients underwent successful TT guided procedure. 4 patients on table we could not do with T probably. I mean, we could not see the dreams, surgical dreams, whether it's inside or not. So we converted into T guided procedure. We did not have any major complications. There's no device embolization. There's no hemodynamic instability or significant arrhythmias, but 10 patients had multiple atrial premature complexes, and 3 patients had a prolonged PR interval, but all they were transient and subsided within 12 hours of the procedure. So there are studies earlier published with the TT and flow guidance. Our studies are different from that because our population is a younger population. That is, 28% of them are less than 2 years and 16% of them less than 1 year. But other studies, they're up to 2 years they are enrolled. Conclusion: if ASD margins are clear, use TT and flow guidance. If there is a difficulty in aligning LA disc when T is used, just pull up the T and probe, see that it's getting aligned. Our experience showed T probe may be a hindrance for LA disc alignment in some cases. And our study research showed high percentage of success with the TT and flow guidance when ASD margins are clear, even in small age groups starting from 7 months. Thank you.